Hey everyone, I'm making a video to um, denote that it is Mental Health Awareness Month. I thought I would make this video just to share a little bit about my own mental health and a little bit about when I was first diagnosed. Um, I was first diagnosed with mental illness um, as a teenager. Sorry about my phone in the background. I was diagnosed as a teen. I was 17 and I was in secondary school at home. I started to get symptoms like severe headaches, severe chest pain, nausea, um, which I now know was anxiety. I was sent to the hospital after having a number of seizures. I'm epileptic, and people, everyone thought my epilepsy was, you know, getting worse, or because my seizures were becoming more frequent. So I was sent to the hospital, and while I was in there, they diagnosed me at the time with acute stress disorder. They later changed it to PTSD. But while I was in there, I used to hyperventilate. I had severe anxiety, panic attacks, night terrors. I was having severe flashbacks at the time about the abuse that I went through. I was also very, very depressed at the time. I had lack of interest in anything. I was very low, mood very low all the time, no appetite, um, just lethargy. As I said, no interest in anything. I was very, very severely underweight as well at the time, and it was just a really difficult time. While I was in there, the medical doctor referred me to a psychiatrist, and she saw me and she diagnosed me with clinical depression, anxiety disorder, and acute stress disorder. So that was my first ever diagnosis by a psychiatrist. She put me on meds and she referred me to a therapist. And when I came out of hospital, I saw that therapist for 9 months before I quit. I stayed on meds when I came out of hospital. I was on antidepressants at the time. I used to see the psychiatrist once a month after getting out of the hospital. And I almost got admitted to the psychiatric ward, but I avoided it for a number of years. I was always tearful. I was very anxious. It was just a really, really horrible time. Eventually, I quit going to the psychiatrist and I quit meds and I quit everything. And it was a year and a half before I went back to any form of therapy or psychiatry. But that was the beginnings of my mental illness. Yeah, it's very hard to live with a mental illness. I know many of you who have mental illness will relate to that, what it does to your life, how it affects your life, turns your life upside down, relationships affected. If you go to school, it's affected. If you go to work, it's affected. Your family relationships, relationships with your partner, friends, everyone, all affected. I think it's even harder sometimes after diagnosis because the family just say, oh, well, you're diagnosed now, things should go back to normal, but they don't. So it's harder. But yeah, it's tough to live with a mental illness. But what I wanted to say in this video is that you're not alone and there is help out there, and sometimes you might find it hard to get the right help, but keep trying because you can get the right sort of help. It takes a while sometimes, but it is there. There are good doctors, there are good therapists, there are good social workers. I know because my treatment team are amazing. They're awesome. I'm very, very lucky with the team I have around me at the moment. But I wasn't always so lucky. You know, I have had bad psychiatrists, I have had bad therapists. So it's a matter of keep trying until you find the right person, and it will eventually happen. Don't give up. That's what I want to say. Don't give up. Help is out there. You're not alone. It might seem like you're alone, but you're never alone. And never give up hope that you will find the right treatment, because it is out there. And that's all I wanted to say, guys. So thanks for watching, and see you next time.